Dr. Joshi, what is the link between obesity and diabetes?
So obesity or extra fat is actually propelling diabetes. Most type 2 diabetes, and again, this is restricted to type 2 diabetes. We have four types of diabetes. Type 1 diabetes, which doesn't make any insulin from the beta cells, is an autoimmune disease. Diseases in pregnancy or gestational diabetes is a distinct entity. Disease of pancreas is a distinct entity. But type 2 diabetes is linked to obesity. And when you have extra fat in our body composition with less muscle, we are generating a lot of insulin resistance because of a sedentary habit and a insulin resistant state, and obesity or extra fat ultimately drives type 2 diabetes. And therefore, when obesity and type 2 diabetes coexist, we call it as a condition called diabesity. And this is nothing but type 2 diabetes. Now, in different geographies on planet Earth, like the African geographies or the Asian geographies, we are lean or thin, but our BMI cutoffs are less, our waist circumference is less, and therefore you might get many people who may have a normal BMI, apparently normal BMI, but yet have diabetes. But they have extra body fat in their body composition. For example, as Asians, we are thin fat Asians, which means we have sarcopenia or less muscle, more fat, and this is ultimately driving to this entire pandemic of type 2 diabetes. The comorbidities of obesity and type 2 diabetes often coexist. And in the good old days, a term called metabolic syndrome was coined. We now don't use that term anymore. But remember that whenever we have a waist circumference more than 90 centimeters in men in India or Asia, and more than 80 centimeters in women, and when we have telltale marks like acanthosis nigricans or insulin resistance, then it will lead to ultimately type 2 diabetes. And it will be associated often with comorbidities or multimorbidities like hypertension, heart disease, sleep apnea, so on and so forth. So diabetes and obesity are directly related. Obesity is often the underlying cause for diabetes. And now we have very good remission data that if you lose fat or lose weight, you can actually get type 2 diabetes, particularly in the first 10 years, in remission, which means that you may not need any medications for this. We have used it through technological routes like twin. We have used it through pharmacological mechanisms. We have also used it through direct trial where we just eat 800 or 600 calories. So you can understand that diabesity is nothing but obesity plus diabetes occurring together. And the more weight you lose, more fat you lose or burn, the better it is. And it has a common mantra to prevent. It is a common mantra to treat, which is eat less, eat slowly, eat on time, eat right. Do a lot of physical activity, at least 6 to 8,000 steps. Have resistance exercises. Try to play some sports under medical supervision and ensure that you de-addict yourself. Try to get a proper sleep and smile. So we are looking at health and happiness outcomes both for people living with obesity and diabetes, and we often call these people as people having diabesity.